Hello and welcome to this Science Says video. My name's Matt Gardner and I used to work as a clinical scientist in radiation safety physics, but now I focus on a range of healthcare science education projects, including the Science Saves programme. Now this was founded to raise the profile of healthcare science and its careers. And in this series of videos, we're interviewing healthcare science staff from a range of specialisms. And in this video, we ask them, what have you been working on during the pandemic?
So for cardiac scientists, during this wave of the pandemic, everything has kind of stayed kind of similar to the normal working pattern. We've tried to not reduce our lists in terms of echocardiograms and in the cath labs quite as much as we did during the first wave. There has been a reduction, but not quite as profound as we saw before. So largely my role has stayed the same. However, I did get some experience on the critical care wards, which was fantastic. I got to learn lots of new skills, work with lots of different and interesting and very hard-working people. And I think what I've come away with that is lots of new skills, like I've just mentioned, but also an appreciation for what goes on in different areas of the hospital that you don't tend to see too much. They were long and difficult days, but it was really invaluable. I'm so glad that I had that opportunity.
So fortunately for me, my day-to-day role hasn't been disrupted by the pandemic. Apart from a 6-week break in March, fertility services have been made available to patients who need them throughout, and so I haven't been redeployed to provide any extra COVID support to other departments. But whilst my day-to-day work hasn't been affected, opportunities outside of work most definitely have. Conferences and other educational events that I had scheduled have either gone virtual or been completely cancelled. But for those that have stayed and been made virtual, I've taken it as a positive as much as I can, I guess, because it usually means that I can attend more events, not take time off work, and in some cases they're actually made free or at a reduced price to what you would usually pay if you were to attend in person. And I've really tried to develop my CV, I guess. I've had lots of spare time outside of work, and as a healthcare scientist, we should always strive for continuous professional and personal development. So I've been doing exactly that throughout COVID.
During the pandemic, I was working with London's scientific director team. I was analyzing some data on mechanical ventilators for Cabinet Office. I was also recruiting healthcare scientists who wanted to volunteer and help around COVID-19 response during the first wave. And finally, I was working with the London COVID-19 Incident Coordination Centre as an operational manager, where I was directing information and data flow across the system.
Apart from working on my STP portfolio, I have worked day-to-day in the lab doing routine work and specialist work. Some of the specialist work includes helping set up the COVID antibody test to determine if a person has had previous exposure to the coronavirus. Created positive and negative controls from pooled patient serum, which were sent around to other hospitals in the region. Other experiments included linearity and interference studies, such as investigating lipemia, icterus, and hemolysis.
We have been with this pandemic to 1 year now. I faced the first wave working as a nurse in an A&E department in Kent. As a nurse, I provide care to COVID and non-COVID patients. With the rest of the team, I was responsible also for maintaining care standard in accident and emergency. Since September last year, I have been working as a clinical bioinformatician in a clinical genomics lab in the Salisbury NHS Foundation Trust Hospital. As a trainee bioinformatician in this position, I am learning to become competent and responsible for developing and improving methods for acquiring, storing, organizing, and also analyzing biological data that support the delivery of patient care.
As a physicist, I haven't been doing any COVID-specific work during the pandemic, but I will share a project that I've been working on recently. So I've been doing a dose audit for a number of mobile CT scanners that travel around to different hospitals in the country to do their CT scans. I have this big data file which contains the information about what scans have been done, the doses that have been delivered to the patient for each one. Now, Public Health England has guidance on what the radiation dose limits are for particular CT scans. So, for example, a CT of the head or the chest. And we also have local dose limits, which we set lower than these national ones, so we can aim to keep these doses as low as is reasonably practical. And so what I'm doing is I'm looking at these doses that these mobile CT scanners have been delivering and seeing how they compare to these dose limits. And so when I'm done, I'll write up a report with my findings, and this will include recommendations if the doses are being exceeded anywhere, so we can look into perhaps the exam protocols or to find out the reason that they are being exceeded if they are.
Our profession is largely outpatient focused, so during the peak of the pandemic, a lot of these services have been cut down and we've been redeployed to help with the COVID surge. This includes working in bed space teams involved in transferring patients along with their equipment around the hospital, for example for CT scans or for bed moves. We've also been working in intensive care to help the nurses with patient care.
I'd like to say a huge thank you to the scientists who took part in this interview. It's been really encouraging to see healthcare scientists both contributing directly to the COVID response, but also in keeping essential healthcare services running during these really difficult times. If you like this video, please do subscribe to the Science Saves YouTube channel and like and follow us on Facebook and Twitter. We're at SciSaves on both of those. Thank you for watching.